Good evening. I'm Leela Shribi from Kannur Medical College. I'm presenting a paper on the category of poisoning and toxicology, and the title name is A Study on Manifestations of Snakebite and Its Complications in and Around Kannur. Introduction. Snakebite is an important public health problem in tropical regions of the world like India because India has always been a land of exotic snakes. More than 2,000 species of snakes are there worldwide, out of which 400 are poisonous snakes. In India, 270 species of snakes present, out of which 60 are venomous. Poisoning by venomous snake bite is a common life-threatening medical emergency in India. In Kannur, common envenoming snakes are cobra, crate, Brazil's viper, and objectives. The vital objective of this study is to analyze the factors which determine the prognosis of patients admitted with snakebite envenomation depending upon their clinical presentation. Prognostic factors included in this study are time since snakebite and admission into Government General Hospital, Kannur, whether the patient received first aid, systemic involvement, site of bite. 30 patients with a history of snakebite with fang marks included in this study and a detailed history of bite including the time of bite, site of bite, type of snake, first aid measures, patient manifestations and history of treatment received from outside have been taken. All patients were undergone following investigations like complete blood count, bleeding time, clotting time, prothrombin time, blood urea, serum creatinine and electrocardiogram. Inclusion criteria. The following criteria were taken into consideration to differentiate snakebite with or without envenomation. Presence of local swelling of limb or necrosis at or around the site of bite, hypotension or shock, laboratory evidence of coagulation disturbances, hemorrhage, neurotoxic presentation, cardiotoxicity in the form of an irregular pulse, tachycardia or bradycardia. Exclusion criteria. Patients who had no fang marks have excluded from the study. Patients with clinical and laboratory evidence of pre-existing chronic kidney disease, patients with clinical and laboratory evidence of chronic lung disease are excluded from this study. A detailed history of bite, including the time of bite, site of bite, type of snake, first aid history, immediate manifestations, history of treatment received from the outside were taken from each patient and the witness. A set of investigations like complete blood count, bleeding time, clotting time, prothrombin time, blood urea, serum creatinine, electrolytes, and ECG were done for each patient. All examinations were repeated to evaluate the progress during and after treatment. Clinical progress was assessed every day. All patients received anti-snake venom according to grading and progression of signs and symptoms. All patients received prophylactic antibiotic surgical intervention like fasciotomy was done for patients who had severe local edema with the compartmental syndrome. Results. Total cases included in the study are 30. In that, 70% are male and 30% are female. Age ranges from 13 to 65 years. Highest incidence was observed in the age group of 30 to 40 years and the lowest incidence was seen in the age group of 51 to 70 years. The incidence of snakebite in the rural areas was 91.4%, while in urban was only 8.6%. In both rural and urban areas, outdoor snake bites were more than indoor snake bites, which account for less than 30%. The highest incidence was truly in agriculture workers of about 86.66%. This is the graphical presentation showing the age distribution, where the 31 to 40 years age group people are more affected. This is the occupational incidence, where the agriculture labor are more affected, and this is the site of incident and the time of bite distribution. These are the neurological, hematological symptoms distribution. Based on the site, the incidence of bite was on lower extremity than the upper extremity, and the rest was 3.3% is real. Based on time of bite, the incidence of snake bite was 17 bites during the daytime and 13 bites during the nighttime. Based on time interval between the snake bite and the admission in the hospital, three patients out of 30 have died. These patients got admitted after 6 hours bite. In this study, out of 30 patients of snake bite, 16 patients showed vasculotoxic feature, 12 patients showed neurotoxic features, and 2 patients expired of vasculotoxic and neurotoxic envenomation. Snakebite is a life-threatening emergency in the study area. Snake bite causes hematological and neurological manifestations. Delay in hospitalization is associated with poor prognosis and increased mortality due to congestive coagulopathy, tissue necrosis, renal failure, and respiratory failure. Unusual complications like pulmonary edema, intracerebral hemorrhage, disseminated intravascular coagulation were observed. Prognosis depends on mode and time of presentation. Patients who received first aid treatment from primary health center have fewer complications than those who did not take any medication before. Systemic involvement worsens the prognosis, and the more severe the systemic involvement, the bad is the prognosis. There was no relation between the site of bite and the severity of pneumonia. The total cases included in this study are 30, in that 70 are male and 30 are female, age ranges from 30 to 65 years. The agriculture workers had higher prevalence of snakebite than the others. Incidence of snakebite in the rural areas were high, and a larger number of bites occurred in fields, which shows snakebite remains a major public health problem in rural population, especially farmers. The bites were almost equal during the day and night. The bites were more common in the distal parts of the body. More incidence is seen in lower extremities. The maximum number of patients reported between 6 to 24 hours of the bite. The systemic poisoning was in the form of following from coagulopathy. In systemic poisoning with viperine bites, hematuria was commonly observed. The next was hematemesis, followed by bleeding gums, melena, hemoptysis, cerebral hemorrhage. There were no coagulopathies in other systemic poisoning. Neurotoxicity, in which ptosis was the commonest presentation, followed by which difficulty in swallowing, difficulty in speech, ophthalmoplegia, drowsiness, and respiratory paralysis. Most of the patients were treated outside by quacks, but only few of them received proper first aid measures. In snake bites with the systemic toxicity, ASV has a definite role in the treatment by reducing the morbidity and mortality. The overall mortality was 6.6%. There was mortality amongst who were treated in our hospital. Eliminations, that is within 6 hours of snake and time treatment of its complications, can reduce the morbidity and mortality. All primary health centers should be equipped with facilities to render first aid measures and to administer ASV. Thank you.